Have you ever stopped to think about this? Some medical tests that are routinely done, especially after you turn 70, might actually be doing more harm than good? It sounds surprising, but today I'm going to reveal the shocking truth behind 5 common tests that many seniors take without questioning. Tests that could carry more risks than benefits if you're 70 or older, or if you know someone in that age group. Then this video is truly essential for you. Because when it comes to health, what works for younger people doesn't always apply the same way to those over 70. In this video, I'll explain exactly which tests to be cautious about, why they can be dangerous, and most importantly, what you can do to take care of your health in a smart and safe way. But before we dive in, please take a moment to subscribe to the Health and Vigor channel. Leave a like and share this video with anyone you want to see living a long, healthy life. And I'd love to hear from you. Comment below and tell me which country you're watching from. It's amazing to see our health and vigor community growing worldwide. So, let's get started and uncover these medical myths together so you can truly protect your health. Test 1. Routine PSA blood test for prostate cancer. Of the most common tests requested for men after age 50 is the PSA blood test. It measures a protein related to the prostate. But after 70, many experts warn that doing this test routinely can cause more harm than good. Why? Because PSA levels can rise for many reasons, not just cancer, inflammation, infections, and even benign prostate enlargement can affect the result, and this can lead to a chain of unnecessary invasive tests like biopsies, which carry risks such as infections and bleeding. Also, many prostate cancers in older men grow slowly and may never threaten life. Detecting a cancer that wouldn't cause problems might lead to aggressive treatments, with serious side effects like erectile dysfunction and urinary incontinence. So, for those over 70 without symptoms, routine PSA testing may cause more anxiety and risk than real benefit. The current recommendation is to evaluate each case individually, considering overall health, life expectancy, and patient preferences. To protect your health, talk to your doctor about whether this test is truly necessary, and always ask if it will help you live better. If you've been following so far, comment with the number 1 below, and if you can, please hit the like button. I really appreciate it. Also, consider making a contribution to help support the channel. Thanks so much for being here. Test 2. Routine mammograms after age 70. Mammograms are definitely a key exam for early breast cancer detection. But when it comes to women over 70, the recommendation for this test should be more careful. That's because many breast cancers at this age grow slowly and may not pose a real threat to the patient's life. Also, mammograms can lead to false positive results, causing anxiety and leading to biopsies and treatments that might be unnecessary or even harmful. Another important point is that after 70, many women have other health conditions that may take priority, and the risks of invasive tests can outweigh the benefits. Therefore, the decision to do routine mammograms should be personalized, taking into account overall health, life expectancy, and patient preferences. It's always best to talk with your doctor to evaluate if mammograms will really help in your case, and to avoid tests that might do more harm than good. If you're still following along, comment to below. Don't forget to like the video, share it with loved ones, and if you can, please consider supporting the channel by clicking the contribution button. Thanks so much. Test 3. Routine Bone Density Scan DEXA Test. The bone density scan, known as the DEXA test, is an important tool to identify osteoporosis and help prevent fractures, especially in older adults. However, for those over 70, having this test routinely without a complete clinical evaluation may not bring as many benefits as you might think. That's because osteoporosis treatment doesn't depend only on the DEXA result. It's based on a full assessment of fracture risk, which includes your history of falls, overall health, mobility, and other factors. Also, some medications prescribed based solely on this test can cause serious side effects, such as intense muscle pain, gastrointestinal problems, and, in rare cases, unusual fractures that can further reduce an older person's quality of life. So before getting a routine DEXA scan, it's essential to talk to your doctor to understand if this test will really make a difference in your treatment and fracture prevention, or if your situation can be monitored in less invasive ways. Remember, caring for your health is much more than just doing tests. It's knowing when and why to do them to ensure safety and quality of life. If you've been following along, please comment with the number 3 below, like the video, share it with your friends and family, and, if you can, please support the channel by making a contribution. Thanks so much. Test 4. Routine colonoscopy after age 70. Coloscopy is an important exam to detect colon cancer and other intestinal diseases. However, for people over 70, the recommendation to do this test routinely needs careful evaluation. That's because as we age, the risks of the procedure increase. There is a higher chance of complications like intestinal perforation, bleeding, and adverse reactions to sedation. Also, many seniors have other health conditions that make colonoscopy more dangerous, and the real benefit of early detection may be smaller, especially if life expectancy is limited. It's also important to remember that colon cancer grows slowly and may not cause significant symptoms for many years. So, the decision to have a routine colonoscopy after 70 should be individualized, always considering the patient's overall health, symptoms, and preferences. It's essential to talk with your doctor to weigh the risks and benefits and decide together the best path for your health. If you're following along, please comment for below, like the video, share it with your loved ones, and if you can, support the channel by making a contribution. Thanks so much. Test 5. Routine electrocardiogram ECG without symptoms. The electrocardiogram, or ECG, is a simple and quick test that evaluates the electrical activity of the heart. But does every senior over 70 need to have this test routinely, even without symptoms? The answer is not always. Doing frequent ECGs without a clear reason can reveal minor or clinically insignificant changes that cause unnecessary worry and lead to invasive additional tests. Moreover, these findings can result in treatments that don't always provide real benefits, but may cause side effects and reduce quality of life. That's why experts recommend routine ECGs only. When there are cardiac symptoms or significant risk factors, always talk with your doctor to understand when this test is truly necessary for your situation. If you've been following along, please comment with the number 5 below, like the video, share it with your friends and family, and if you can, support the channel by making a contribution. Thanks so much. Now that you know these 5 medical tests that might do more harm than good after 70, it's important to remember your health is unique. Always talk openly with your doctor, ask questions, and make informed decisions that fit your personal needs. Taking control of your health means choosing smart tests, avoiding unnecessary risks, and focusing on what truly helps you live stronger and longer. If you found this video helpful, please subscribe to Health and Vigor, hit the like button, and share it with your loved ones who deserve to live well. Don't forget to comment below with your country and your thoughts. I love hearing from our amazing global community. And if you want to support the channel even more, consider making a contribution. Your help means a lot. Thanks for watching, and I'll see you in the next video. Stay healthy and vigorous.